Okay, and again, I want to welcome you all to our presentation this morning. My name is Ashley Singleton. I am the Program and Research Manager at the Injury Prevention Research Center at Emory, or IPRICE for short. And today we are partnering with Prevent Child Abuse Georgia and the Department of Public Health Injury Prevention Program to give a really, hopefully insightful presentation about adverse childhood experiences and some of the work that's happening across the state to prevent adverse childhood experiences. So we welcome you all across Georgia. We have people from literally every corner of the state. So we're glad that you are here today. So with that, I also want to make note that unfortunately, we were not able to secure the 1 credit hour, the nursing credit hour, but this is still really important information. We hope that you all will stay and for the next hour with us. We will have future webinars where CME hours are offered. So please keep an eye out on our website, iprice.emory.edu, for future webinars that will have those CME credit hours available. Okay, so Jyll, I'm going to pass it over to you.
Thanks, Ashley. So I'm Jyll Walsh. I work at Prevent Child Abuse Georgia. We're housed in the School of Public Health at Georgia State University. And we are one of the statewide leaders for primary prevention in the area of child abuse and neglect. And our organization, along with the Georgia Center for Child Advocacy, have created kind of a collaborative effort that is really trying to effectively communicate what adverse childhood experiences are to communities and how we can prevent them. So we call these adverse childhood experiences ACEs, which you'll learn about if you don't already know some about shortly. So this collaborative effort is a trauma-informed approach to respond to ACEs and serves as a community outreach and engagement platform. And so we're going to talk about those ACEs, adverse childhood experiences, both nationally and also locally here in Georgia. What does that data look like? And then a bigger project on what's going on, Grace is going to share with you right after that. So I'm also going to provide some information, not only on ACEs, kind of the bad part, but also on how caring adults, caring connections even, can serve as a primary buffer to adversity and trauma, and also share a few examples of how you can help build resilience in children as well as the adults around you. So we'll close by talking a little bit about the Connections Matter initiative in Georgia, and I have some links to put in the chat at the end. But Ashley, if you can launch that poll, I just want to see before we get going, how familiar or not familiar you guys are with ACEs. So we'll give you just a couple seconds to fill out the poll on your screen, and this is going to help. Go ahead and answer that poll question, just how familiar you are with ACEs. And Ashley, when we have most people taking it, we can go ahead and share the results. Awesome. So it looks like almost half of you guys are very familiar. You've been in there, you know what it is, you've seen it, you work with people, you've dug a little deeper. Some of you are somewhat 30%, a little bit 16, and not at all. So this is going to be a great launching point for us. And I'm going to go a little bit deeper, hopefully into some things that you don't know about yet. And even so, a little bit of what Georgia statistics look like. So you might know what's going on nationally, but we're also going to talk about what that looks like in our state. So I'm going to show a short video on what ACEs are for those who aren't quite sure. This just does a really great job of summing it up for you guys. And give me a thumbs up if you can hear it when I click play. Let me turn it up and then go again.
We all like to think of childhood as this time of joy and innocence. But, I mean, for many of us, it's just not true.
When you grow up in these type of situations, it's not something you talk about. I know I didn't.
The first thing that we found is that adverse childhood experiences are common.
young, they don't know what's going on, they won't remember anyway. Well, the child may not remember, but the body remembers.
There was this incredible gee whiz effect. You mean adverse childhood experiences cause heart disease and lung disease and liver and cancer?
Exposure to trauma affects children's developing brains. The impact is on your behavior, it's on your heart, it's on your DNA. Like, how do you deal with all that?
I don't reach out because I'm not used to that.
We have a whole new body of knowledge now that could open up what we have up till now been seen as intractable, unsolvable problems.
No child should be punched or kicked. No child should be punched or kicked.
If you can get the science into the hands of the general population, they will invent very wise actions.
Do you feel like any of the interventions have been making a difference?
They made all the difference in me.
And the fetus attitude is completely disconnected.
Okay, so that was just a 2-minute trailer of the documentary Resilience. It came out a little bit ago now, but it wasn't to the mass public. Even if you go on YouTube and just Google Resilience documentary, you can find some clips like this if you wanted to share it. So ACEs are one of those largest investigatory studies that happen between early childhood experiences, such as child abuse, neglect, household challenges, and the potential outcome in lifespan health and well-being. So it's just a quick summary. This whole mission is really what Laura Porter said in that documentary. If we can get the science into the hands of the general population, they will invest very wise actions, or they will create very wise actions. And we see so many of that going on. When people know better, we do better. When we see the child's behavior, how can we respond better? Things like that. And so it's not that people don't care, it's that they don't know. And so bringing the science and awareness and how we can then help or respond or prevent is really kind of the emphasis of Prevent Child Abuse Georgia and this Connections Matter initiative. And so to summarize the ACEs study, it was done by Kaiser Permanente and CDC back in the 90s, and it was looking at people with health insurance. So these people already had some protective factors in place. They had health insurance, they likely had jobs that provided that health insurance that had them access to it. So these are people that already had some higher health level status than a lot of the general population out there. So within this group of adults, they found that those who had experienced early adversities were more likely to have those negative health outcomes as adults. And so this was really a seminal study, and many, many offshoots and other ones have been done since that replicated it and looked into other kind of subcategories of this. And so what we've learned from that is that ACEs are common. So the ACE study asked participants about their experiences just with 10 specific types of childhood adversities occurring within their household. And this included 3 types of child abuse, 2 types of neglect, and 5 household challenges. The study found that 64% of Americans had at least one ACE, and more than 1 in 5 reported 3 or more ACEs. So this is an increased likelihood of experiencing additional ACEs, especially with an incarcerated family member and domestic violence in the home. They'll experience multiple of that comorbidity there. And so we have the 10 up on there, but we know that that 10 does not represent all trauma going on. There's a lot more trauma that could be occurring within early childhood and especially into adulthood. And if you guys want to put in the chat box, what might be some other early adversities a child might go through or early traumas? I see we have 71 people. So put in that chat box, what are some other things that could be an early childhood trauma that's maybe not listed on that slide? You see homelessness, absolutely. Bullying, chronic illness, when parents are deported, yeah, unsafe neighborhoods, you see lots of bullying. Racism, absolutely. The loss of a family member, friend, divorced parents, yeah. And parents divorcing is actually on that one. Loss or death in a family, access to transportation, groceries, food insecurity, poverty. I think the 1 in 5 children who live at or below the federal poverty line in the state of Georgia, and that was before COVID. So 1 in 5 children who are at $25,000 a year or less for their annual household income, that's severe. That certainly causes a lot of chaos and vulnerabilities that they are more likely to experience as children. And you think of the parental stress that can ensue, and then the type of impact that might have on their parent-child dynamic, that can be really intense. Community violence. Yeah, so you guys listed some really great ones in there. COVID. Thank you, Lauren Gregory. Absolutely, this whole pandemic that everyone is going through, and all those signs that say we're all in this together. Yes, we are all experiencing this as a generation, but we're not all impacted the same way. So those who are already having vulnerabilities are more likely to have a severe impact. So great responses, guys. Thank you. And so remember I said that the original ACEs study found that about 64% of Americans had experienced at least one ACE. So now we're going to look at how Georgia stacks up. So the first Georgia ACE study data was collected in 2016 and then again in 2018 from the behavioral risk factors data system that DPH collects. And you can find that on the DPH Oasis website. So you can actually get raw data on there if you want to look at it yourselves or go into it a little bit more. So this is a phone-based survey conducted through the state of Georgia with non-institutionalized adults. So adults that were not incarcerated or in nursing homes and over the age of 18. The combined data mostly models the outcomes of what we see at the national level. And in the sample, we have about 12,000 Georgians represented. So for Georgia, it found that 3 in 5 or 60% of adults had experienced at least one ACE. And so this means that about 40% had no ACEs growing up in the state. And we can see just looking at the demographics as well, that females had a slightly higher prevalence of 4 or more ACEs. And we use 4 ACEs as kind of like that threshold where the negative outcomes become more significant at that point versus none. So 4 ACEs is kind of that threshold we use in data terms or evaluation terms. We also saw that having 4 ACEs did not significantly differ by race or ethnicity for the state of Georgia, and the college graduates were significantly less likely to have 4 or more ACEs. And so we can see from this graph, this is also Georgia data as it relates to child abuse. So these are the different types of ACEs that they looked at when collecting data. And so this was the prevalence of those ACEs within the population. So of those who have reported ACEs, 33% reported parental separated or divorce, 26% substance abuse in the home, and then it goes back to emotional abuse, violence between parents, physical abuse, mental illness in the home, and so on in there. And a lot of these can also be kind of comorbid or co-occurring, especially the different types of violence. And just as a reminder to mute yourself, just in case. And the number of ACEs a person has in childhood and the risk of negative health outcomes, they are related. So the higher the number of ACEs, the greater the risk of poor health outcomes as adults. So that dose-response relationship. As the number of ACEs increases, so does the risk of alcoholism, depression, liver disease, suicide attempts, smoking, heart disease, adolescent pregnancy, illicit drug use, or work performance. So we can see it's not just those health ones, but it's also health behaviors and other things like that that can lead to different health outcomes. And all of these really do increase the risk of early death or early morbidity. And so what's really important is that you guys remember that poor health outcomes noted in the study are not predictions, that these are not causal relationships. These are associations. You're more likely to have it. It doesn't mean that it's going to be a sentence, a death sentence, or necessarily be causal of it, but they are correlated and more likely to occur. And that our system also, if we look at the top, we see disease, disability, social problems, we see early death. A lot of our systems in society is set up just to address that top piece of it, just to address the disease after you're sick. Oh, now we have an intervention, or the death, or social problems. A little bit of them, kind of more primary, secondary prevention, will look at kind of health risk behaviors like smoking, domestic violence, or things like that. But very few of our public health or broad sweeping ones really address preventing adverse childhood experiences before they ever occur. Or how do we prevent disruption of brain development? How do we really focus on social, emotional, and cognitive abilities in children or resilience in them? So our system is really just looking at the tip, but we're always going to be flushing people up there unless we're getting to the root of it. And I also want to give out another kind of scary statistic, and that is those with an ACE score of 6 or higher, increased risk of dying was 20 years earlier than those with no ACEs. So we know that this is, although it's a correlation, it's a big scientific finding. So again, in Georgia, when looking at health behaviors and outcomes for Georgia adults reporting 4 or more ACEs compared to those who reported 0, we saw that they had a significant chance or increased risk of different health behaviors and outcomes than those who had none. So here we can see on the chart that those in green, I'm missing a little, sorry guys, oh, there's my legend. So the green is those who reported 0 ACEs, and the dark blue is those who had reported 4 or more ACEs as a child. And so those who had reported no ACEs experienced less poor or fair health. Those who had no ACEs reported a lot less depression, less difficulty making decisions, a lot less of them smoked or reported heavy drinking and driving, and HIV risk. So all of these are health behaviors and also health outcomes in there. And you can see the mental health of it as well. And so compared to the national data, adults with 4 or more ACEs compared to 0 are 6 times more likely to have clinical depression, 3.6 times more likely to have serious job problems, and 2.2 times more likely to have a heart attack. And so our Georgia data is definitely backing that up here when we're looking at all these things. So the Department of Public Health, others who are looking to prevent all these things from occurring, a lot of it can be stemmed back to early childhood adversities and how we're setting people up for success or how we're kind of missing it early on. And so ACEs really tells us that childhood trauma impacts a child's development and well into adulthood, their trajectory. And these footprints represent that lifespan. Exposure to strong, frequent, or prolonged stress without adult support can disrupt the development of healthy networks of brain connections in young children. So we call this toxic stress. And toxic stress can take a toll on a child's physical and mental health, and the effects can last a lifetime. The Adverse Childhood Experiences study has revealed childhood trauma can impact a child's education, mental health, physical health, and even job future productivity, as we saw in those other slides. And so I want to just say a note about trauma. So trauma is another one of those words that is often heard, perhaps misunderstood. So keep in mind the definition for trauma is a deeply distressing or disturbing experience. So on the other hand, toxic stress can occur when these experiences are long in duration and intense. And it's also really important to understand a person's perception and what protective factors they have around them, because perception of trauma is important, and how you have your community or support to bounce back is important as well. And so what does this look like in a school system or a classroom? So students with higher ACEs are more likely to fail a grade, score lower on standardized tests, have language difficulties, be suspended or expelled, and have poorer health. And so what does our system set up for right now? We need to get the teachers back in there. We need to teach harder. We need to teach up to this. How do we have better standards or curriculum? When really we see a lot of it is what's going on at home, their environment, community-wise as well, that needs to be addressed, not just what's going in the classroom, but how outside has a huge impact on what's going on inside. And those with 7 or more ACEs are highly likely to have a developmental delay even. Academic failure, academic problems, behavior problems have a 12% prevalence in those with 0 ACEs. And for those with 3 or more ACEs, there's a 52% prevalence of that academic failure and behavior problems. So that's a big difference in our children and just how they're coming up to school, let alone what they're learning there, but just how they're showing up that we need more investment and attention on. And so some just takeaways from the ACEs is that they are common, they are cumulative. Nearly 1 in 6 adults reported 4 or more ACEs, so that's that next kind of threshold. And the ACEs are associated with negative health, behavior, and socioeconomic challenges. But all of that aside, how do we focus on the kind of prevention of it? And I like to reinforce again that these risk factors, these early adversities are not predictive factors. They're not causal. And they especially don't have to be, because the protective factors and resilience and how do we buffer and mitigate these things? So positive experiences can buffer those bad experiences. So whenever we talk about adverse childhood experiences, I believe it's equally important that we're talking about protective factors and positive experiences, such as relational wealth and social connections, being connected in a healthy way. So just one positive, stable relationship in a child's life can balance those negative outcomes and build resilience. And there's new studies, Dr. Segi and others have really looked at the outcomes of positive experiences or having protective factors. And they've seen that just that one positive, influential caregiver mentor can really mitigate and buffer the outcomes, even if they have ACEs. So we're talking about how do we tip these scales that children can thrive? How do we build up these protective factors? And one way that we need to really modify the approach when we see a child engaging in negative behavior or an adult, even in self-destructive behavior, this is an opportunity to shift our language. So instead of saying what's wrong with you or even thinking what's wrong with you, internal dialogue is important too. We want to be asking what happened to you. When we don't have words or the social emotional ability to communicate what is wrong, our behaviors become our words, our actions become our words, and we don't know always how to cope with that. So asking, what happened to you? And relationships can be so powerful and protective that they can prevent those physical health problems. So this slide is an example of part of a study that demonstrated how supportive maternal caregiving reduced the likelihood of stress-related illnesses. And in this case, it was asthma among children growing up in homes with domestic violence. So these children are at a higher risk of being diagnosed with asthma due to the stress that they're experiencing at home. Nurturing relationships can be a game changer even in these tough times. So engaged and supportive parenting helps protect children against toxic stress among children growing up in otherwise similar environments. Among vulnerable families, children who have parents who are supportive have fewer emergency room visits and lower biological stress markers within their system. Whether they are in a stressed out state or even not in a stressed out state, they're going to have higher levels of those cortisol levels. And so the adults in this scenario, they don't have to be parents. It doesn't have to be a mom or a dad. It can be others in the child's life as well. So take, for example, the other Wes Moore. So this was a book released based on someone's real life. So there are two kids named Wes Moore, born just blocks apart within a year of each other. Both grew up fatherless in the similar Baltimore neighborhood and had difficult childhoods. So both hung out on the street corners with their crews, both ran into trouble with the police. So how then did one grow up to become a Rhodes Scholar, decorated veteran? He was a White House fellow and business leader, while the other one ended up a convicted murderer serving a life sentence. The child who thrived moved with his mother to live in his maternal grandparents' home, who were loving and supporting. So they had additional adults in the life of the child that were there to be that positive influence, to have that love, to be that nurturing. So just that one protective factor, that one positive adult influence can make all the difference, allowing a child to identify hope, recognize their own strengths, and thrive. The thriving Wes Moore says in his book, the chilling truth is that his story could have been mine, and the tragedy is that my story could have been his. Had it not been for these folks who helped me and ushered me into manhood in the way they did, things would have been very different. And I actually have a personal story that is the exact same as well. My brother-in-law grew up in extreme poverty and experienced many ACEs, and he's a twin. And so he grew up, he went to college, many years later graduated, and is now successful in his field and loves his job, versus his twin sister, who is in jail, has had children in foster care, and has lost other children there. And what happened, and I asked him, how did you get out? That's, I think, the age-old question. And he said that he was on a sports team and really became close with those other friends and their family members. And the other parents really took him in and showed him what it meant to be in college or have resilience or be that buffer for him when things were going on, versus his twin, who really didn't have that type of connections with other people outside of their immediate network in there. And so we know this to be true, just those, doesn't have to be a parent, but those connections make a huge difference in buffering adversity early in childhood. And so I want you guys to think as a child, who was an adult that had a positive impact on your life? And I want you, if you want to close your eyes or keep them open, I want you to think of 3 details about that person. Maybe something they said, something they taught you, something they did for you, a way that they made you feel protected, encouraged. And if anyone wants to share that adult and maybe a characteristic of that adult that was a positive influence in your life. So feel free to put that in the chat box. Thank you, Ashley, put her pastor, great listener. Yeah, being heard, especially in your youth or childhood, being heard, validate, listen to. A teacher who believed in me, absolutely. A pediatrician, she made me feel seen, yeah. As adults, do we like to be seen? Yes. Children do too, if not way more so. Teachers, yeah. And so in my childhood, we grew up in a cul-de-sac, and I think, you know, if you can be in a cul-de-sac, that's always where it's at. You get your big wheeler out and you just go in circles all day. But the parents around us, my friends' parents, you know, we were always there just as their kids as well. It was kind of the same. Their parents were my parents and vice versa. So to have those additional supports that you can go to and to show you a school counselor, showed you someone of value, yeah, and helped you navigate to college, yeah. An uncle who believed and listened. The 5th grade teacher always took the students, always took what the students had to say seriously. They listened. So a lot of this is just saying you felt heard, you felt listened to, you felt encouraged, or someone believed. How difficult is it to listen? How difficult is it to believe? You know, so reinvesting that back in there and looking at programs in our systems and how we're doing that and in ways we're not, or creating barriers for professionals to do that. How much do we put on teachers? How can we better help teachers be that? We know they want to, that's why they're there. I believe it takes a special kind of person to be a teacher, an early care worker, anything like that. So we know they have that heart. So how do we help them be that? So thank you guys so much for sharing all of those ones and the qualities that they had that really made the impact on your life. So now we're going to talk a little bit about building that resiliency in children. And I bet a lot of what we review are the qualities that you guys just talked about as well. So here we have a list of building resilience in children. And a lot of it is what you just said. So encouraging confidence, we believe in you. How do we help you take those action steps there? So even when it might be someone helping you navigate to get into college, that you don't have anyone with that experience in your background, but you have that someone who can help you build those competencies and build your confidence to do that. Creating confidence. Confidence is a solid belief in one's own abilities, and it is not built by telling kids they're special or precious, but rather children gain confidence as they demonstrate their competence in real situations. So when parents and professionals support children in developing competence, children can cope with these challenges and really gain the confidence to try new things or push through. Knowing that you've done it before is going to help you know that you can do it again and push through to make those choices. Being a connector. So children with close ties to family, friends, schools, and communities are more likely to have a sense of security that produces strong values and prevents them from seeking self-destructive alternatives. So family or strong, supportive, nurturing relationships is a central force in a child's life. But connections to civic, educational, religious, and athletic groups can also really increase a child's sense of belonging and wider kind of exploration of the world, and feel safe to do it as well. Building character. So every family has its own idea, cultural values of what good character is. So whatever the specifics, children need a foundation sense of right and wrong to ensure that they are prepared to contribute to the world and become a stable adult. So this is a character. It helps children become comfortable sticking to their own values and demonstrating caring attitudes towards other for them. Developing those opportunities for contribution. How do you guys feel when you give back? Or how do you feel when you were productive and able to contribute something? It's a great sense, right? So not only social connections that go one way, always receiving, but to giving back as well. So this is really important to teaching children empathy, that social emotional intelligence early on. So when we talk about social emotional intelligence, some really early skills are not just telling a child, be quiet, be still, calm down, don't do this. It's really encouraging feelings, and it's okay to express them. They're not always going to feel good. They're going to cry when they don't get what they want. I know you're upset about that. I hear you. We're not going to do it today. I'm sorry you're upset, but we can do it later. Or how do we help them calm down when they're upset? So instead of just saying calm down, modeling it for them. So in ways that are like, take a deep breath, shake it off, touch your nose, listening ears, and now tell me what's wrong. And we're helping them verbalize their feelings. We're modeling how to calm down, because physiologically, it can be really hard to calm down. And then we're asking them to express or communicate their feelings. So we're letting them give words to it and start that communication process, versus children who don't have empathy or are able to communicate. They're just acting out. So those behaviors become their words when they're not able to express their feelings, or they don't feel safe expressing their feelings because someone is always telling them to stop crying, shake it off, things like that. So these are also good coping strategies, also letting them express their feelings, have those words. In Georgia, it's something called freeyourfeels.org. And it is kind of a social campaign to help adults enable children to express their feelings. And that really helps the mental health of children and adults, I feel like. And then modeling control. So again, not feeding into those angers or not feeding into those things, but helping to model those things like calming down. Let me take a second before I respond to this. Let me show you how we are going to model encouragement, model 6 steps of action, and give that reinforcement there. And all of these things can really help, them take an active role in their health and mental health, and being that own resiliency along with the support of others around them. So nurturing relationships not only support children, but are also beneficial for adults' health. So relationships help us to cope and recover from stressful situations. They also improve our quality of life. When we have strong connections and supportive relationships in our lives, we have better physical and mental health. Even we live longer and we feel richer. The studies show that people report feeling richer, even if they actually are, if they just have a better social network, more friends, or people around them. So research has shown that when we have a friend at work, we tend to work harder. How many of you guys believe that? There's something to look forward to. You want to talk with someone versus not having anything to look forward to, not connecting with anyone. So being social helps connect our brains in other ways. It makes us sharper as well, feeding off of each other, that give and take and that caring relationship that we can have in our personal lives and also professional lives to some degree, depending on your environment, but allowing people to be people and recognizing their emotional needs as well to connect there. So all of these things have been shown just for adults as well. And so we always want to kind of end my segment with a little bit of good news, and that although a lot of these ACEs, the adverse childhood experiences, many of them, although they are occurring at the individual level, a lot of them are impacted by community or society practices, protocols, policies, especially, that need to be looked at and addressed. But these are all preventable. And not only are they preventable, if they do occur, they can be mitigated and reduce the outcome or negative outcome by having positive relationships and those other social supports around the child. So by creating these healthy communities and focusing really on primary prevention as much as possible, we can reduce this risk for ACEs and hopefully mitigate those who are impacted by them as well. And so Connections Matter is it's a 4-hour training that is trauma informed, and it's for anyone. It's for professionals, it's communities, it's for people who have never heard of ACEs, faith-based organizations, offices that are corporate even. This applies to everyone. And one thing why we really focus on that personal relationship is because it's something everyone can do. We do other trainings that talk about societal factors and policies and things like that. And you can play a role in that, but creating that safe, nurturing environment for a child and being that protective factor is something that everyone can take a role in. And so we offer a longer 4-hour training. And I just put the Connections Matter website into the chat box. And so this is just a little introduction of it. We're going to come back to this question because I'm going to pass it off to Grace now, and she's going to talk about some of the really strategic aligned work that is going on in the Department of Public Health and with many, many partners throughout the state to look at ACEs and how we can work to prevent them using the data that we're collecting in those strong partnerships. So I'm going to pass it off to Grace.
Thanks, Jill. I am going to share my screen. Okay, can everyone see my screen? Great. So hi, everyone. My name is Grace Morrow. I am the PACE D2A program manager at the Georgia Department of Public Health, and I work in the injury prevention program. So PACE D2A stands for Preventing Adverse Childhood Experiences, Data to Action. Today, myself and Ashley Singleton, who is one of our partners at iPrice, are going to provide you with a really brief overview of all of the great work that we're doing as part of PACE D2A. So PACE D2A is a CDC-funded grant, and the overall purpose of it is to improve ACE surveillance infrastructure, access to ACE's data, and to implement evidence-based ACE prevention strategies throughout the state of Georgia. It's a 3-year project. Our funding started in September of 2020. It is going to go through August of 2023. And there are actually 5 other states that have also received PACE D2A funding. Two new states, New Jersey and Connecticut recently Minnesota recently started just earlier this month. So PACE D2A has 3 interconnected focus areas. Focus area 1 is to build Georgia's ACE surveillance infrastructure. Focus area 2 is the implementation of evidence-based ACE prevention strategies. And focus area 3, the data to action component, is the way in which we are going to be utilizing the ACEs data from focus area 1 to support and to assist with the implementation of ACE prevention strategies that are being used across the state. So focus area 3 is really how focus 1 and focus 2 sort of interact with one another. So now I'm actually going to hand things over to Ashley Singleton from iPrice, who is one of our great partners at PACE D2A.
One way I like to think about the work that we're doing is creating a data hub where we are compiling relevant data sources from across the state that represent statewide data, community level, local level, regional level data all in one place. And then that central location will be a web-based mapping tool. And this mapping tool is made with the community in mind. It's a way to easily access information about ACE trends and prevalence. I know we've talked about what's available on DrPH OASIS, but there are other data sets that are available. We have that listed here on the slide. So bringing all those data sources together and data points together that will allow easy access for people like you all on the line today. All of these tools have a primary goal to provide data for community members, nurses, teachers, social workers, with the data that they need to make plans and decisions to prevent ACEs. So although this is a 3-year funding source, we are embedding sustainability in every step of the way. And I know Grace is going to talk a little bit about what our sustainability plans are, but we also have a poll that we'd like to launch just quickly asking you what about your data needs. And so I'm going to just quickly launch this, and it's asking how useful would the PACE D2A data tool, so the maps, fact sheets, be for decision-making and strategizing for your organization or community. So if you could just take a second here to let us know how useful would this data be for you and your community. And thank you so much for responding to the polls. I'm going to give it just another quick second. Okay. So we have over half of you all saying that it would be very useful or extremely useful. And towards the end of this presentation, we have another slide or two. We'd love to have an open-ended conversation with you all about what products you'd like to see from this project, how you would like to be engaged and involved. So Grace is going to wrap up our presentation, but we definitely want to have that open-ended conversation with you all in just a second here.
Thank you, Ashley. And thank you everyone for letting us know what your thoughts are on the products that we're currently producing. So to provide a little bit more information about how we're addressing focus area 2, so that's the implementation of evidence-based ACE prevention strategies. There are essentially 3 things that PACE D2A is doing. So a really big part of PACE D2A is building upon previously existing work that different organizations have been doing throughout the state of Georgia, and to support them in those efforts. So we have a lot of different partners that we work with. 3 of our biggest partners, in addition to iPrice, are the Georgia Essentials for Childhood Coalition, Prevent Child Abuse Georgia, and then the Division of Family and Children Services. And so we're all working together with regards to this focus to do 3 different things. First, we're working with local community representatives from each of the 14 DFACS regions across Georgia. Now, these 14 DFACS regions make up all 159 counties of Georgia, so we're really working with the entire state. And we're working with these local representatives, and these are folks who are part of local NGOs, folks who are in school systems. Some of them are local government workers, some of them are concerned parents and family members. And we're working with them to identify ACE prevention strategies that can be used within each of those regions. And as part of that, what we're doing at PACE D2A is we are going to be sharing our mapping tool, but then we're also designing fact sheets that are specific to each region around the specific types of ACE prevention strategies that they've chosen to use. And we're also working with them to provide any additional information around data that they might like. Secondly, what we're doing is through our public education's campaign approach is we're working with those 14 DFACS regions to support the promotion of the Belonging for Hope campaign. I'll drop a website, the website link to that in the chat, but Belonging for Hope campaign is a really collaborative effort that is trying to let folks know, so all the different ways that they, as their unique roles, the unique roles that they hold, maybe as a teacher or a bus driver or a doctor or a neighbor, how they can help support children and their families throughout the state of Georgia. And then the third thing that we're doing is through our early childhood home visitation approach. And for that, we're taking a list of resources. So a lot of that is the data that iPrice has been compiling and analyzing for us. And we're going to be identifying some of the geographical gaps in ACE prevention resources and programming throughout the state. So that was just a really quick rundown of what we're doing at PACE D2A. It's a really big project. Could definitely talk about it for a lot longer, but we wanted to make sure we had time for any of your questions. So if you have any general questions around ACEs or ACEs in Georgia or PACE D2A, please feel free to ask them. And if you want to learn more, if maybe talking in a public sphere isn't your jam, that's totally fine. I'm going to drop my email and Ashley's email into the chat, and you're more than welcome to reach out to us. We would love to chat with you. Right, I'm going to turn it over to Ashley. Did you want to do that other poll? Okay. Yeah.
For our folks on the line who mentioned that the data products would be very useful or somewhat useful, would you like to share with us what types of products are most helpful for you in the work that you do? You can either raise your hand, unmute, or leave that response in the chat. We love having these conversations, so please feel free to unmute if you'd like. Okay, Margaret, thank you so much. Local data is exciting. So Margaret, would you like to unmute, please, and maybe expand on that a little bit?
Yes, hi everybody. I just think the opportunity with tools and the types of data available to get more local for your community is an exciting thought, to look at all of Georgia is important, but I think to empower community organizations to address ACEs in their community and maybe understand how their community varies from the norm in Georgia, but also nationally. Most of my work is in maternal health, and that's something that we're thinking about, how do we highlight opportunities to do better for communities by helping them understand, what is happening in other places, but then understand their data locally.
That's really helpful, Margaret. What types of data sources do you use currently? Margaret, if you don't mind me asking.
Yeah, I guess I am sort of joining, I guess, more just like as a general interest person. It doesn't directly relate to my work. So there are, and I'm not able to put my hands on them or my tongue on them right now exactly, but my professional work uses the Maria maternal mortality review data. So I think that's not something that's necessarily available to the public. And then I work also with Healthy Mothers, Healthy Babies Coalition of Georgia. And we have done some work to try to identify sort of by district and by county, some of the data. And I can't recall exactly where this is from the Georgia Department system, where you can try to understand infant mortality, prematurity, et cetera, by county or district. And we're trying to do more with that to try to amalgamate data at the maternal health level is a little less available. So that's something there's opportunity for that, which isn't focused for you. But I think that district, whether it's to influence your legislators or also to influence programming decisions, are all important. So I think as I think about data, I think the opportunity to get more micro and help empower community leaders versus seeing it at a state level.
Okay. That's really helpful. And I hope you all know that we are taking notes on this because we are in year 2 of the grant. And this is a time where we are turning out our fact sheets and our maps. And so we want to hear from you what's useful, what's helpful. That's really an important conversation that we want to have with you all. A couple more messages here in the chat. Let's see, Kim, the data can give us insight on things going on in the home that we may not realize. We face new challenges almost daily. So this would give us the most current. That's really helpful. Kim, anything else you would like to add on that? If you'd like to unmute, or if not, that's totally fine. Fozia, I see you also left a comment, so.
Who did you say? I'm sorry.
Kim?
Yeah, that's me. I'm sorry.
That's okay.
So can you hear me?
Yep.
Okay. Well, I just moved from Virginia to Georgia. I've been a mental health worker and a teacher for over, I guess, 30, 40 years, and the last 15 years in the mental health field in the homes as I'm working on my LPC. And one thing I've noticed since now I'm a counselor at Hartwell Elementary, right in the heart of things, I'm seeing more of and different stuff every day, not just the norm, parents are divorced, the incarceration, a lot of blended families and relationships, from mom, dad having different kids. And that's very hard on them. So having the most current update is really going to help me be more successful because I face something and a challenge new every day. So this will be good for that and me in the learning process and connecting more with resources because I've lived in Virginia all my life. I knew all the resources. So now I'm trying to get as involved as I can to learn them here as well.
And I think that really piggybacks nicely, Kim, into the next question. How do you access, or when you're looking for this data, when you're trying to find it, especially as a newbie in the state, where do you go to, where are your reliable sources that you venture to?
Well, really, the principals and people at the school is helping me a lot, or looking with them connections, because I just had so many. And back home, we called it DSS, Department of Social Service. Here it's DFACS. There are different acronyms for everything. I'm just really having to learn everything all over. But just the word from the people that's been here a long time. And we have the school social worker that's in our whole area. So she's been very helpful I know how to ask and say, this is what we did at home. So what do you have here that's a different name? So I think your site and being able to look and even have you guys as a contact now is going to help me tremendously. But I know one of the biggest things that I want to do is find resources for the parents and bring the families involved, even if I have to do, my biggest thing with is, I know it starts at home. So how can I get the parents involved and do a family thing in the classroom, because I have a big classroom as a counseling office, and involve them once a week to say, hey, we want to help your child, but we can't help without you on board. That's huge. So if you have any other resources that would help me, I would be more than glad to jot them down.
Absolutely. I think, Kim, we have some resources that are left in the chat. I'm trying to listen and keep an eye on the chat. So I believe that we have some from Linda and other places. What we'll do is we'll compile those resources and make it available to you all who attended today. And I hope
that would be awesome. And will we get I was about 4 minutes late. Will we get access to have the PowerPoint?
Yes, absolutely.
Okay. All right, super. Thank you.
You're welcome. Thanks, Kim, for those comments.
So I just wanted to quickly highlight some of the other comments that folks have shared in the chat. So Allison said that Head Start programs have to do a community needs assessment with their federal grant. So any local data at the county level would be really helpful for them. Fozia says that local data can help with grant applications and can help influence how folks apply and leverage their resources. And Linda said, visit our website. We're teaching the community resiliency model with the support of Resilience Georgia. That's another organization that we're working with on PACE D2A, and they're doing trauma-informed, resiliency-focused, body-based emotional regulation skills to people across Georgia. Fozia has also mentioned that data where families can access care, both pre-pandemic and during the pandemic. So their child's pediatrician, urgent care, that sort of thing. One-page fact sheets for legislators would be helpful.
Jennifer, I know there is an ACEs committee that is assembling at the Georgia State Legislature. So I know a lot of this data is going to be going into that.
Yeah, thank you, Jyll. Jennifer mentioned that outreach to service providers, including healthcare, about toxic stress and buffering with safe, stable, nurturing relationships is great. And it would be helpful to communicate these messages to parents and caregivers. And then Arthur also mentioned that this data and information would be helpful in dealing with children in stressful situations or children who are experiencing abuse. So thank you so much, everyone, for these comments. We really appreciate them. Are there any other additional questions or comments that people would like to share? You're welcome to unmute or to drop it in the chat.
So this is Margaret. I will also just add that thinking about how to use this data with healthcare providers is something I would, love to think about or put on the agenda, because I think you've presented the case for the connection with health and well-being. And so, whether that's both in the clinical setting, like how do healthcare providers understand the questions they could ask, but also in the advocacy and policy realm to help get support, whether that's Medicaid reimbursements or other kinds of ways to amplify the importance of addressing ACEs and trauma in the healthcare setting.
Margaret, I think that's a really excellent comment, because we all have a role in this fight to prevent ACEs. And so thinking about from a clinical perspective, thinking on a local level, thinking about parents and what they need, That's really what we're striving to do with PACE D2A, is to think about all of those different players and providing data to support those conversations. So I want to be mindful of time and just say thank you again to everyone for participating in this conversation. I'm going to drop the link for iPrice. This is where we will have more information and updates about PACE D2A. And so please, please be keeping your eyes open for updates, fact sheets, the mapping tools that will be made available. And we'll also create a resource page and share that with everyone on the line today. Jyll, Grace, any closing comments or words?
I just wanted to thank everyone for being here and investing your time into learning more and how you guys can be a better support. One other resource would be Resilient Georgia. I've seen a lot in the chat box, and our slides will be valuable. So feel free to reach out afterwards as well. Thank you, Ashley.
Thank you all. Have a good day.
Thank you, everyone.
Goodbye. Thank you.
Hi, do we receive a certificate?
Hi, Lori. Thank you so much for mentioning that. I mentioned at the beginning of the session that unfortunately we were not able to get the 1 CNE credit hour. However, we will have additional webinars offered throughout the next few months that will have CNE credit hours. So.
Okay, thank you so much.
Thank you for attending.
And good